If you or someone you care about is dealing with non-Hodgkin's lymphoma, you're probably looking everywhere for solid information to support your care. So let's get right into it and explore what the science is actually telling us.
This is the big question, isn't it? You're doing everything your oncology team recommends, but you can't help but wonder, what else is out there? What does the research say? Well, this explainer is designed to help you navigate some of those very findings.
So, to guide us through this, we're looking at a collection of peer-reviewed studies. You can think of it like a map of the current evidence, showing us where some of the most interesting research is happening and what a lot of smart people are looking into.
Okay, before we go one step further, we need to pause here because this is so important. This is absolutely not medical advice. Our only goal here is to arm you with good information so you can have a better, more informed chat with your own oncologist. Please never make any changes to your diet, your supplements, anything without talking to them first.
All right, let's kick things off with a topic that's getting a ton of buzz in cancer research lately: vitamin D3. We're going to look at what the data from a key clinical trial seems to suggest about its link to how people do during treatment.
Let's start with a number that really jumps off the page. In one study looking at patients on a common chemo regimen, those who had consistently low vitamin D levels faced a 4.68 times higher risk of something called inferior event-free survival. Okay, so what in the world does that actually mean?
Well, event-free survival, or EFS, is basically a measure of how long after treatment a person remains free of any complications or a relapse. And what this study found was a really clear difference. Patients whose vitamin D levels stayed low, they had worse outcomes. But, and this is the exciting part, those who got their levels corrected up into a normal range saw significantly better outcomes.
And hey, don't just take my word for it. Here's a direct quote from the researchers themselves. They said that their work provides the first evidence that just getting those levels back to normal was linked with a better outcome. See? This is the kind of stuff that can spark a really productive conversation with your doctor.
So, we've just seen how something like a vitamin might play a part. Now, let's switch gears completely and talk about a common type of medication, statins. Turns out, researchers are also finding some really interesting correlations between people using statins and their survival outcomes.
Now get ready for this number, a 61% reduction in the risk of cancer-related mortality. Wow, this was found in a huge analysis of patients who were on a specific targeted therapy drug. For the folks in that group, who also happened to be taking statins, the difference was just remarkable.
But, and this is a really important but, the effect doesn't seem to be the same for all types of lymphoma. The evidence for a big benefit looks really strong in certain types, like follicular lymphoma. For others, like the more common DLBCL, the data we have so far suggests it's, well, pretty marginal. And understanding this kind of detail is exactly why you have these conversations with your doctor, not with the internet.
And for our last spotlight, let's look at an essential mineral, magnesium. You know, there's a growing amount of research looking at how the levels of minerals like this in our blood might be connected to a patient's prognosis in cancers like DLBCL.
An analysis of more than 400 cases of DLBCL reported a 1.4 times positive impact on outcomes for patients who started treatment with normal to high magnesium levels compared to those who started with low levels. It's yet another one of these significant connections that keep showing up in the data.
So what's the potential connection here? Well, the leading hypothesis is that since magnesium is absolutely vital for our immune cells to work properly, having low levels could basically hobble our T cells, the soldiers of our immune system, making them less effective. It's a pretty cool example of how our basic nutritional state might really impact how our body fights back.
So, those were just 3 deep dives, but believe me, the research out there is so much wider. Let's do a quick-fire round of a few other areas being studied, just to give you a feel for how broad this field really is.
You've got a ton of research, for example, on the gut microbiome, linking specific bacteria to better treatment responses. Then there are studies looking into iron metabolism and how to keep it balanced. You see research on things like beta-glucans for immune support, curcumin for taming inflammation, and even vitamin B3 for its role in keeping our cells healthy. Each one of these is like a doorway to a new set of questions you can explore.
Okay, we've just gone through a lot of data. So the biggest question of all is, what on earth do you do with it? This next part is all about how to turn this info into a safe, responsible, and empowering next step.
It's really a simple 3-step path. First, you learn. Use what we've talked about as a starting point. Second, as you learn, write down your specific questions. Things like, hey, I saw that study on vitamin D levels. Could we check mine and talk about it? And third, you take that list of questions to your doctor.
When you do that, you shift from being just a patient to being an active, informed partner in your own healthcare. It's a game changer. And that right there is really the whole point. This isn't about choosing science or medicine. It's about asking this one simple question. How can we safely bring together the best of evidence-based research with the best of standard medical care to create the most complete, personalized path forward for every single person?